The chances of my crossing paths with a predator in 1992 were, maybe at the shopping mall, which is where it happened, maybe my bus stop, maybe walking to someone's house. But today, a predator can access a kid anywhere by using the internet. So it doesn't matter how rural your community is. If there's a child in your community who has unsupervised access to the internet, then they're at risk.
It became very clear that this is not just a big city problem. It is not just a rare occurrence. This is common, and it really is all across the country. And so as we began talking with staff afterwards, and she has amazing stats from these training programs, it was almost like no one had ever thought about the role a healthcare worker can play in identifying victims of trafficking.
What Connects Us is a project that the federal government started a couple of years ago. It's called SOAR, Stop, Observe, Ask, Respond to Human Trafficking. Now we will be going forward with this SOAR training, having CEU credits for doctors, dentists, nurses, social workers, mental health, substance abuse, and public health people.
I can't tell you how many rooms I've walked into to educate staff where they were not happy about being there, but by the end of the session, they want to know more. They want to know, how can we address these victims? I've had multiple staff members say to me, I've had this victim. I've had this person as a patient.
So creating that window of opportunity where the nurse, maybe it's even the triage nurse before they even go back to the back, but certainly in the exam room with the physician or the nurse, taking the time to separate the patient from those who are hanging around and giving them the freedom of conversation. Now, they may not open up. They may have fears and lots of other reasons why they don't share or they deny. But at least if we're intentional, we create the opportunity for that conversation.
Have your protocols in place before going in for education and knowing what resources are available in the community before going in for education, because once you have your staff in a position where they want to help, they're fired up, if you don't know what resources are available, they're gonna feel reluctant to identify a victim because they feel like if I identify this person and there's nowhere to take them, then I'm putting them in a worse situation.
Who should be involved? You suggested mandatory training, and I agree. And then you start to ask the question, where should it stop? And it can't stop with a doctor and a nurse. It has to include, the EMS people that came in. It has to include the front desk person.
You've got to have internal protocols set up for when you identify a victim, and you've got to start to create relationships with local law enforcement so you know who to reach out to, and with community resources so you know who to reach out to that can come in and help your patient.
We have changed our whole policies, our protocols, our teaching, our efforts and all that. And that's what I want you to all think about as you go about your lives and you connect up with your churches, with your schools. Demand it. If you don't get a call from the hospital down the street because they don't want to listen, demand that they start teaching. Demand that those urgent cares, demand that the 911 operators.
It's not just law enforcement, it's everyone. Everyone can be a community leader. When I talk to churches, I go to a church, I'm talking about human trafficking. I look at the pastor and I look at the leaders of the church and I say, you too can help end human trafficking. So what I'm saying, Randy, we all are playing our part in this. And in that way, we can end human trafficking. I truly believe that.